Welcome to CCBC Library Instruction for Nursing 2 students. First, I want to say congratulations for getting your first semester under your belt, and thank you again for going into such an important field, especially at this time in our world. Um, we're going to be reviewing some of what we talked about in the fall in the video instructions. And I just wanted to let you know, as far as the library, again, we offer nursing students the course-specific resources, the databases, there's online academic coaches, and you can get me and the staff at chat, email, or phone, or meet us in Teams. So anything you need help with, give us a call. We're out here for you. Okay, we're going to talk some more about evidence-based practice. I know you had an assignment in the fall. We had people in, some of you students, really sifting through the databases to look for your featured studies. So I just wanted to talk to you a little bit more and we'll review some things. And if you have any questions, again, please get back to me. So first of all, we're going to have story time. I used to do the children's story hour at the Rochester Library, so I'm going to put you through that. But this has to do with evidence-based practice. This comes from Implementing Evidence-Based Practice, Real Life Success Stories by Mazurek, Melnick, and Fineout Overhault. So, the title of this article is Mother and Baby Survive Cardiac Arrest Due to Research Study. And it's written by Lisa Gay, who is a Master's of Science in Nursing and college nursing faculty at Brown Mackie College in Indiana. On one Friday the 13th, I learned the importance of evidence-based practice. My pregnant 32-year-old daughter and her husband were attending movie night at their church when she suffered a full arrest. She had no cardiac history and had just been to her prenatal checkup the week before. I had been an OB nurse for several years and had not detected any problems. Thankfully, some people at the gathering were trained in CPR. She was taken to one of the few hospitals in the United States that was participating in a research study that used hypothermia protocols on specific full arrest codes. The premise is that reduction of body temperature reduces the flow of toxins to the brain, thereby conserving neurological function. But problems arose when the hospital personnel realized she was pregnant because this procedure had never been trialed on a pregnant client. Because she was not quite 20 weeks in gestation, it was decided that the baby was not viable without the mother, so a very brave emergency room physician opted to include her in the study. Lowering her body temperature worked, and she survived the 48 hours. Her arrhythmia continued to be a problem, and on her second day of life support, her cardiologist told us she needed to have a defibrillator pacemaker implanted or she would not survive. But she had aspirated and now had pneumonia with the accompanying fever. Thus, she was not a surgical candidate. We prepared for her to die. One nurse caring for her kept muttering that he had read something in one of the nursing journals about an external defibrillator vest that he thought could buy her time until the fever broke. He spent the next few hours scouring the internet to get information on the new equipment. At 3 a.m., he exclaimed, "I found it." And without any hesitation, he phoned the cardiologist and awoke him to ask him permission to get the new equipment sent to the hospital. Every nurse knows how daunting it must be to wake a doctor in the wee hours of the morning, much less ask about obtaining experimental equipment. The doctor ordered the vest. By dawn, a company representative had flown it in from out of state, and the cardiologist and I were meeting with him to get our training on the vest that could potentially save her life. I remember being scared about getting the vest up and working in time. I also worried about the grandbaby and how much damage we had caused him. He had been oxygen deprived and defibrillated, in excess of 20 times. His mother had been without spontaneous heartbeat for more than 45 minutes. He had been given cardiac medications and chilled to the point where you could see him shivering on the ultrasound. His unconscious mother was on life support for more than a week. On a warm day in July, our new grandson entered the world. He is perfect in every way. We nicknamed him Zap because he had been defibrillated so many times. He earned his name because he is one busy guy. Our daughter continues to improve. We have been truly blessed. We had a nurse who followed the nursing journals and paid attention to research, and had doctors and a hospital that participated in a research study that would change our lives forever. We had the man upstairs who saw fit to let everyone survive intact. But that is not the end of the story. Ironically, I was given a chance to pay it forward when a student at the college where I teach suffered the same type of full arrest. I was summoned to the room and performed CPR with a coworker. The student was given the same hypothermic treatment and survived. It's only 1 month later, and she has already returned to her job, and next month she plans to re-enroll in classes. So, there's your story time. And I just wanted to use that particular article to demonstrate that's why we're talking today, and why we spoke in the fall, and you have assignments every semester. So just to go back to evidence-based practice, it's looking for research on how do you know what to do at the clinical site. And if you recall in the fall, I talked to you about the major Canadian nursing journal study that was done years ago in the late 80s that showed how nurses made decisions. And at that point, it was a huge study, and nursing journals were near the end of what nurses chose as their point of reference for making bedside decisions. So again, with the article and with the studies, we wanted to continue to have you realize that we need to close that research gap, and learning how to research through the library is part of that. And just to review, evidence-based practice, you take the available scientific evidence, which is our part that we're talking about today, with your expertise, which is what you're learning in your nursing classes, and what you will learn on the floors, and the patient's preference. And that threefold model is how you do decide what needs to be done from the clinician's viewpoint. So this is the assignment that you have every semester. You had one in the fall, and again, I saw some of you in the library. And it is hard work looking for research, and I think some of you realize that it's not like a 10-minute process. So, and you have to be able to tear it apart and look for what is fitting for you in nursing. So many times these practices are involving you ask that clinical question. And we talked about that in the fall, asking the question and what the components of the question is as far as your research when you have a patient and you're trying to look into what will help them. So you look for that evidence out. We went to various places. We're going to go again to those databases and PubMed and all those credible studies in the nursing journals. And then you see what is valid and look at the hierarchy. And then you take that evidence and you put it toward making better procedures or better specific care plans for your patients. So These are just some examples of some questions that nurses that you could ask. And they're the kind of things that you would be researching as a nurse because it is a different level than physicians research. So if you know, a lot of times it's about interventions and prognosis, or there are those protocols like you see with your hospital care sheets. That's all based on your evidence based practice guidelines and drug outcomes. So to come up with those questions, if you recall, we used the PICO model. So here again of the review of what PICO stands for: population, intervention, comparison, intervention if there is one, the outcome, and the time frame. And I have some clinical questions for you, and you can just go along in your head. In hospitalized adults, how does a rapid response team compared with no rapid response team affect the number of cardiac arrests and unplanned admissions to the ICU during a 3-month period? And then you just tear that apart, and those are the terms that you use, and those are also, again, as we talked, when you come up with this question, that definitely distills what you're looking for as far as when you go to the research part of finding answers. Here's another one. In men, does having a vasectomy increase the risk of getting testicular cancer in the future? So we have our population, intervention, and their comparison. The one before this had a comparison. This one does not, and the outcome. So, very good. And so then we could use those as search terms. So I figured I'd tell you my story from this year. This is my dad and my grandson. So in the earlier part of the year, when it was after COVID had been going on for a while, I had been taking my dad to the doctors. He had had an onset of breathing difficulties, and they hadn't tested him for COVID. They had ended up doing an echo and said that he had a blockage. And so he ended up going in to get a stent. He had had a very healthy heart, but they were telling us that there was ventricular damage. So he had a stent put in, and we thought that was all going to be fine. Everything went well with the procedure. And then they decided to keep him in the hospital, and then put him in quarantine for COVID testing, which we had been going to the doctors for several weeks, and we were kind of surprised by that because we had asked about it before. So while he was in quarantine, I got that call that no one wants to get, that my father had arrested twice. They didn't know what happened in quarantine, but that he was non-responsive. Well, as a daughter, I lost my mind and said, I'm coming to the hospital, and they had said that I couldn't see him. And finally, after much convincing, they said yes, I could, that they had him on a ventilator. So I was prepared to say goodbye. They said that they would allow one of us to go in. So I went in. I was very lucky that I had a nurse that agreed to allow me to see my father because they didn't have to. So anyhow, I went to see him in the ER with 13 or 14 of my family members standing in the parking lot, and talked, got to talk to him on the ventilator. And later, I had a call from the nurse that night, in the middle of the night, that he had pulled the ventilator out and spoken to her. So we knew that he had come through 2 bouts of CPR and being non-responsive to actually having, his brain activity and everything. So long story short, because I'm going on, but he ended up on the ventilator, and we had big questions because we wanted him to be able to come off that ventilator quickly and start rehabbing. So we had questions about elderly people on ventilators and what you needed to do to get to liberated from that and to be on your own breathing. So you go ahead and think about what your clinical question would be in my father's case. So, and we'll go back to that a little bit later. So, congratulations. We've come through the review, and I know the PICO was something that we talked about and you learned to do, and everyone seemed to catch on quickly that came in to have research help with how to whittle down to those terms. And remember, as you're doing searches, you want to change terms up too. So, in my father's case, the population. Elderly men, seniors, over patients over 65. Just change those terms up when we're searching. So anyhow, the other thing I wanted to remind you of is that as we look for research, that it comes at different levels. And last time I had you examine the evidence-based practice pyramid. We talked about how credibility is it becomes a higher quality as you go up the pyramid till you have the gold standards. Again, you didn't have to memorize every single kind of study design, but you have to be aware of where it is in the pyramid and to be able to check as you examine studies. The one thing we didn't talk about in the fall, and I think this is very important, is about filtered versus unfiltered information. So when you were looking in the fall, you were looking for original studies. That's considered unfiltered. Yes, it's all peer reviewed. It still has gone through that very rigorous peer reviewed process. But as you can see, this is more primary research. Whereas filtered resources up there at that gold standard and the tip of the study design, you'll see systematic reviews and meta-analysis. And what I'd really like you to do is when we finish this portion of the recording is have you go again and watch. I know I had that, I call it the Looney Librarian video. I am just so thankful to Annie H from West Carolina who did it because it really shows study design and talks about each design. So when you're doing your methodology or checking and picking your article, you'll be able to fit it into that pyramid and see where it stands. So I'm going to put, after I finish this first portion of the recording, I'm going to put the links again. She has a short video that I showed you initially in the fall, and she also has like a 14-minute one if you really wanted to get more in depth about the evidence-based practice pyramid. And again, for me, it really opened my eyes to the various study designs for the nursing journals. And besides the pyramid, there's also a lot of graphs out there that show the hierarchy of evidence that you can check into and become aware of. The other thing with your assignment, you need to look about qualitative versus quantitative research. And in the purple here, I have like some of the keywords of what you can see qualifies more as quantitative or qualitative. So, now, in the fall, we talked about the places that I didn't want you Googling or going to work PubMed, or that was no longer accessible. So we have places where you can find this research as you did in the fall and as you'll do every semester. So, I wanted to reiterate that pubmed.gov, plos.org, National Library of Medicine, those are all good places to go. I like to guide you to our databases because they're more geared toward nursing. And I know some of the professors, like Professor Zachi, they actually want to see that the writers are nurses. So, when you go to PubMed, you might see other kind of health professionals, doctors that do the research. However, I mean you really find good material there. So nurses do use PubMed, but for our purposes, I like to see you start in our um, nursing databases. So these are just a couple of the nursing hard copy uh, journals that we have. I think we have 11 or 12 different titles, and we keep back to 5 years. Remember, we want to stay in that 5 year range. We keep them in the archives and in the library. So once we're in house again, you can always come in and look at these, and it's very helpful to hold them in your hand and like flip through. AGJN has original research features that they have. So I'm going to call a stop right here, and then we're going to come back and do a little bit of searching, and I'll review. We'll go on to the virtual library again. Please check out beneath where I post this. I'm going to feature that hierarchy of evidence-based practice, the pyramid video. I'd love for you to watch again. So thank you very much, and I'll be back with you soon.